we are not seeing the public response as we hoped. So far, approximately 20 members of our community are now fully vaccinated, with 57 awaiting their second dose.
Health authorities in the U.S. Virgin Islands are concerned about the weak demand for monkeypox vaccination, even as cases in the United States mainland continue to climb. As of Monday, September 26, there were almost 25,000 monkeypox cases in the country across all 50 states. As the USVI is a major hub to and from the U.S., local public health experts are encouraging the local population to protect themselves.
Monkeypox vaccines are safe, effective, and provided at no cost. The department has approximately 603 doses of the preferred monkeypox vaccine, Jynneos, available, and encourages persons who feel they might be at risk to consider getting vaccinated by calling 340-774-9000 extension 4663.
The Centers for Disease Control reports that although monkeypox is not a sexually transmitted disease, more than 99% of cases in the current 2022 U.S. outbreak have been among men who have sex with men. That is why Ruben Malloy, Assistant Commissioner of the VI Department of Health, is urging those in that demographic, as well as people in other high-risk groups, to come forward to be vaccinated.
The populations included in our first tier of vaccinations are those who are at high risk for infections from monkeypox. Among these vulnerable populations are healthcare professionals, such as laboratory workers, ER, public health, or urgent care clinical staff, and EMS personnel, men who have sex with men, or any of the following individuals who, in the last 3 months, have had 2 or more sexual partners, been using street drugs during sex, had syphilis, gonorrhea, chlamydia, trichomonas, or any other acute sexually transmitted infection, been incarcerated, attended a sex party, or visited a group sex site. And lastly, sex workers are also at high risk for infection.
In an effort to boost vaccination rates, the Communicable Disease Division will, over the next 2 weeks, conduct an assessment based on calls made to the monkeypox hotline that will further encourage vaccination trends. Meanwhile, in a bid to expand healthcare services, this Wednesday, the Virgin Islands Special Supplemental Nutrition Program for Women, Infants and Children, otherwise known as WIC, will break ground on its new headquarters in St. Thomas 5 years after the original building was damaged by Hurricanes Irma and Maria in 2017. The $3.7 million facility will provide centralized services to pregnant and breastfeeding mothers, non-breastfeeding postpartum women, as well as infants and children up to age 5, Malloy said. He also announced that the abatement and demolition work for the Charles Howard Memorial Complex on St. Croix was approved by the Coastal Zone Management Board on September 20th, signaling the start of that $291 million contract to rebuild the facility as a community health clinic and wellness center.